just like any other disease, to be honest. I mean, I have a good amount of Pacific Islander patients and Latinx patients. I mean, they're the ones working in factories, working in slaughterhouses, working in fields, not getting a day off, having to work in close proximity, living in close homes, and not having health literacy, not having literacy, not having resources. So what does that equal? And so, I mean, the on the ground is that it's rough. People aren't able to put food on the table. People are struggling to pay bills. Collective anxiety and depression is probably the highest I've seen in my short time practicing. The amount of antidepressants and therapy and suicidal patients. And I think it's probably globally having that impact. And so there's another, like, I did the public health dance and I did biostats and epi, but I'm all about data and studies, but I really, if I just convince the students, there's lots of studies that we've done, and just if you just stick with the basics first, and like I feel like Dr. Daniels was saying, we're studying a lot of nuances at this point, and to get back to the basics and how to do that. If you can't do the basics, to add nuance onto that is really tough. And Adrian talked about like I guess it's like a community asset mapping approach, or like a amplification, of course. And that's why like the Latin paradox they talk about is for Latino paradox, with them being healthier and what a collective family can do. Those are of course assets that affected communities could use. But I just worry about a narrative more and more putting like the personal responsibility and putting it on communities and putting it on innate characteristics versus just like we're the richest country of all time and probably one of the richest counties of all time in this current one. And so like what do we collectively think we can do and implement now and go from there?